Our first panelist for today is Dr. Nishchal sir, and he's a child specialist and teenager health consultant, a multifaceted, positive, dynamic person, and I think it's better we start listening to him now. Over to you, sir.
Sure. Thank you so much. Disclaimer, this is the sponsored session, sponsored by GSK Vaccines, and we are going to talk about changing scenario of hepatitis A disease in India. Which vaccine to choose for protection? So we all know that evolution of hepatitis A disease over time. The Adolescent Health Academy is started in 2000 and it has been 25 years. So if we see the hepatitis A disease before 2000, the pre-vaccine era, majority of the population acquired hepatitis A infection early in life, such that large proportion of population is immune to hepatitis A vaccine. The disease was self-limiting as it was happening to the young children, and we all know it was extremely self-limiting disease. And hepatitis A occurred in a cycles every 10 to 15 years, with majority of cases reported among children, and it was less than 15 years. So it was in the initial years, burden was on younger children. But now the endemicity is shifting, and hepatitis A disease is currently the vaccine era. It is decreasing seroprevalence across the country and increasing incidence of infection. Why this is happening? Because increased hygiene, increased cleanliness, safe drinking water available. So there are no chances of natural infection of hepatitis A vaccine. And because of that, the younger children, if they are not vaccinated, are susceptible to hepatitis A vaccine when they are adolescents. So it is very, very difficult for us to control this in this situation. So shifting endemicity owing to improving living conditions, and that is positive, and we have seen this after COVID in a very big way. So what is it is changing? If we see in 1983, it was almost 97.58% was anti-HIV positive. And if we see in 2012, it is 37.5%, and I think 2025 it is even reducing more than that. So 2 out of 3 children in the past used to have vulnerable to hepatitis A infection less than 10 years. So we all know this. If the hepatitis A disease happens to younger children, the severity is very, very less. Child will feel a little anorexia for few days, a little jaundice here and there, a little weakness, and within few days child will recover by itself and everything is absolutely fine. So less than 6 years it is 70% asymptomatic and only 10% will develop jaundice. But if it is more than 6 years, more than 70% will develop the jaundice. If we see this hospitalization severity, less than 24% hospitalization rate for less than 15-year-old, but if it happens more than 15 years, it is approximately 45% children may require hospitalization. And we as a practicing pediatrician, we are seeing these trends. Hepatitis A in adolescents most probably will require hospitalization because of lot of complications occurs along with that. And the average hospitalization was 7.6 days with 20 to 180 days of work loss. So parents will also have to suffer what is going to a child. And if we see the expense of hospitalization of a child, it is approximately 25,000. So hospitalization costs more than the vaccine which can cost to us. The another important area why we must vaccinate children in the prevention of hepatitis A is hepatitis A outbreaks are becoming a major public concern, and this has been in various news in last 20 years. So according to IDSP report in India, overall hepatitis outbreaks reported in 2021 accounting for 110 cases, whereas for the year 2022-23 it was 977 cases. So number of outbreaks every year are increasing, and it is really a case of concern. and 84 districts India reported outbreaks from 2017 to 2021, and numerous outbreaks of hepatitis A India have been reported because of contaminated water or food. The sewage water is getting contaminated in the drinking water, and that is what is happening. And in these outbreaks, if you see the age group, it is 6 to 30 years who were most affected in these children. And we all know prevention is better than cure. We have been talking about emotional vaccine, and this is really very, very good vaccine which we have. If we use this vaccine, then definitely it will be a very good thing to do. So improved sanitation, food safety and immunization are three things which is very, very important to prevent hepatitis A vaccine. Now, what matter while choosing a hepatitis A vaccine? Because we have many hepatitis A vaccines now available in India. But depending upon the use of this vaccine, reduce childhood exposure to virus, increase susceptibility to older children, and increase risk of outbreak in adult and adult childhood. That necessitates vaccination in these children. So if we see various vaccines which are available in the country, we all know from GSK it is Havrix, Evaxim from Sanofi, HappyBev from BE Abbott, and BioVac A, which is a live attenuated vaccine from DRL. Now, Havrix, why it is apart from others? Because they have persistence expected for at least 50 years. So when a child has received 2 doses 6 months apart, today the science says that they are at least protected for 50 years, and they have clinical data of more than 20 years. And another important thing is availability of co-administration of other vaccines. So this vaccine can be given with all the vaccines like typhoid, yellow fever, tetanus, measles, mumps, rubella and varicella. Now Evaxim, HappyBev and BioVac A has around 10 to 15 years of experience, and modeling will give the protection up to 10 years to maximum to 30 years. Whereas GSK's Havrix is giving protection up to 50 years. So this is amazing. Second, differentiating between these two molecules is between HappyBev and BioVac, they don't have any data of co-administration of other vaccines, because we know we give first dose of hepatitis A is 1 year, and there are other vaccines which needs to be given, and the second dose is given at around 18 to 24 months. There also there will be few vaccines should be given like yearly influenza vaccine, and the data may not be available. So it is very difficult to be confident about giving this vaccine. Now if we see the other vaccine like Chinese hepatitis A vaccine, so 43% seroprotective subjects, and this is the GMC titer which is required. So immunogenicity studies should have a baseline seronegative subjects. So immunity study of Havrix, if we see pre-vaccination status, 100% seronegative subjects have been given the vaccine, and post-vaccination 1850-fold rise in GMC has been observed. So an amazing increase in the GMC titer in these children. Now if we compare the available inactivated vaccine, so Chinese origin inactive vaccine as well as the Havrix, and then we'll come to know that in Havrix it is 100% seronegative Indian children have been used, 18 to 50-fold rise in seronegative subjects, 100% seroconversion in 14 to 19 days. Why this is very important? Because during outbreaks, if we start vaccinating the other people in the community, we can definitely save them from developing hepatitis A vaccine. There are 5 studies in low endemic countries studied across the age groups, annual 20 years follow-up and up to 50 years of protection. So this gives a very long-term protection in these children. So Havrix is the first licensed vaccines of hepatitis A, 29 years of real-world experience, 150 control trials involving more than 30,000 subjects, and more than 85 countries having Havrix registered all over the world. So we are very confident when we give this vaccine to prevent hepatitis A in children. We are not only preventing children, we are preventing outbreaks also, a long-term protection of 50 years, and almost zero outbreak or zero breakthrough in these injections. And we all know It is very safe vaccine. I have never come across any side effect after hepatitis A vaccine, which is Havrix. So very common is mild irritability, drowsiness, loss of appetite. Very uncommon is rhinitis, and only 2 contraindications, and we all know hypersensitivity to any component of vaccine, and those who have shown signs of hypersensitivity, we have to be careful. Now, as over a period of time the vaccination is taken over by the government set up in a very big way post COVID, we must increase communication with every child who visits to us during even sick visits. We should have one Saksham counselor sitting in the waiting area talking to the parent about the vaccines. Parents should be proactively told about next vaccine, why this vaccine, what is the cost of the vaccine, and if they are told, then by 1 year, because 1.5 month, 2.5 month, 3.5 month, 3 vaccines are almost taken up by the government. So we should start talking about the 6 months vaccines, 9 months vaccine, and 1 year vaccine, because flu, the typhoid fever vaccine, hepatitis A vaccine, and chickenpox vaccine are till not given by government. So we must proactively maintain this in the clinic so that this vaccine can be given, and we all must give at least 2 doses of hepatitis A vaccine Havrix to all children who are more than 1 year. Now there will be some children who will come to you, or the parent who will come to you that, sir, we don't have the record of this vaccine, what can be done? Or we don't know we have given the vaccine or not. Now there are 2 ways to tackle this situation. One is, we may get the serotitre of these children, but it is a very costly affair. So it is always better, if there is a doubt of vaccine given or not, or if there is no record available with the children who are adolescent age, it is always better to give 2 more doses, because vaccine costs very less, the investigation costs more. So we must proactively give this vaccine to all children from 1 year onwards and protect them from this severe disease which happens to adolescent and adult age, which may cause complication and hospitalization, and some cases loss of life. So thank you so much for patient listening.